Good evening, everyone, and welcome to tonight's virtual town hall hosted by County Executive Calvin Ball. I'm Angela Cabellin, Deputy Chief Administrative Officer. Tonight, we're going to take this next 90 minutes to discuss vaccine distribution in Howard County. I'm pleased to introduce tonight's guests. All are remotely participating on their phones. You'll hear from County Executive Calvin Ball, Health Officer Dr. Maura Rossman, Superintendent of Howard County Public Schools, Dr. Michael Martirano, Dr. Shafiq Ahmed, Interim President of the Howard County General Hospital, Dr. Clarence Lamb, Maryland State Senator, Chief William Anashevsky from Fire and Rescue Services, and Director of the Department of Community Resources and Services, Jackie Scott. We will be taking your questions live. If you have a question for the speakers, just press 0 on your phone keypad now, and you will be added to the queue. When it is your turn, you will be connected with an operator who will take your question. We'll try to answer as many questions as possible. I also want to say that if we don't have time to get to your question tonight, please stay on the line after the event, and you'll be able to record a message for us. Or you can email cball@howardcountymd.gov, and we'll have a response for you. Again, thank you to all who are joining today. Many are dialing into this town hall, this telephonic town hall. My name is Angela Cabellin, and I am hosting tonight's virtual town hall. We have with us County Executive Calvin Ball, our Howard County Health Officer, Dr. Maura Rossman, Superintendent of our Howard County Public Schools, Dr. Michael Martirano, Dr. Shafiq Ahmed from the Howard County General Hospital, Dr. Clarence Lamb, Maryland State Senator, Chief William Anashevsky, Fire and Rescue, Director of the Department of Community Resources and Services, Jackie Scott. Right now, we're dialing out to thousands of people so that they can hear about vaccine distribution in Howard County. We're going to get started in just a moment. But for those who are just joining now, who want to ask a question on tonight's event, all you have to do is press 0 on your phone keypad to be added in the queue. We're going to try to take as many questions as possible, but I said earlier, if you do not get your question in tonight, please stay on the line after the event, and you'll be able to record a message for us. You can also email us at cball@howardcountymd.gov. Again, for those of you who are joining tonight, thank you so much for joining. Good evening and welcome to tonight's virtual town hall hosted by County Executive Calvin Ball. I am Angela Cabellin. I'm the Deputy Chief Administrative Officer. Tonight, we're going to take this next 90 minutes to discuss vaccine distribution in Howard County. I'm pleased to introduce tonight's guests. All are remotely participating on their phones. You'll hear from the County Executive, as I mentioned, but also Health Officer Dr. Maura Rossman, Superintendent of Howard County Public Schools, Dr. Michael Martirano, Dr. Shafiq Ahmed, Howard County General Hospital, Dr. Clarence Lamb, Maryland State Senator, Chief William Anashevsky, Director Jackie Scott of the Department of Community Resources and Services. We will be taking your questions live. If you have a question for the speakers, just press 0 on your phone keypad now to be added to the queue. When it is your turn, you will be connected with an operator who will take your question live. We'll try to answer as many questions as possible. I also want to say that if we don't have time to get to your question tonight, please stay on the line after the event, and you'll be able to record a message for us, or you can email cball@howardcountymd.gov. Again, my name is Angela Cabellin, and I'll be hosting tonight's virtual town hall with County Executive Calvin Ball, Health Officer Dr. Maura Rossman, Superintendent of Howard County Public Schools, Dr. Michael Martirano, Dr. Shafiq Ahmed, Howard County General Hospital, Dr. Clarence Lamb, Maryland State Senator, Chief William Anashevsky, Fire and Rescue, Director Jackie Scott of the Department of Community Resources and Services, and we will be taking your questions live. If you have questions for the speakers, just press 0 on your phone keypad now to be added to the queue. When it is your turn, you will be connected with an operator who will take your question. We'll try to answer as many questions as possible. I also want to say that if we don't have time to get to your question tonight, don't worry. Please stay on the line after the event and you'll be able to record a message for us, or you can email cball@howardcountymd.gov. Okay, we are now going to get started officially, and I want to do one last introduction as you have heard, and then we will immediately hear from County Executive Ball. I want to start off one more time and say good evening and welcome to tonight's virtual town hall hosted by County Executive Calvin Ball. I'm Angela Cabellin, the Deputy Chief Administrative Officer. Tonight, we're going to take this next 90 minutes to discuss vaccine distribution in Howard County, and I'm pleased to introduce tonight's guests. All are remotely participating on their phones. As I mentioned, County Executive Calvin Ball, Dr. Rossman, our Health Officer, Superintendent of Howard County Public Schools, Dr. Michael Martirano, Dr. Shafiq Ahmed, Interim President of the Howard County General Hospital, Dr. Clarence Lamb, Maryland State Senator, Chief William Anashevsky, Fire and Rescue, Director Jackie Scott of the Department of Community Resources and Services. We will be taking your questions live tonight. If you have a question for speakers, just press 0 on your phone keypad now to be added to the queue. When it is your turn, you'll be connected with an operator who will take your question. We'll try to answer as many questions as possible. I also want to remind you, if we don't have time to get to your question tonight, please stay on the line after the event and you'll be able to record a message for us, or you can email cball@howardcountymd.gov. And now, without further ado, I'm excited to turn it over to our County Executive, Dr. Calvin Ball.
Thank you so very much, Angela. Really appreciate your leadership, and thank you to all of the panelists who are so gracious with their time and are such fantastic partners in helping to keep us safe. And especially, thank you to all who are joining us this evening. We know that there are many pressing concerns and questions. We're going to try to answer many of them tonight. There is a light at the end of this tunnel now that we have vaccines available. However, I know that many of you on this call are anxious, and understandably so. We're hopeful that, like our diagnostic testing last spring, supply will scale up quickly in the coming weeks and months. We've only been at this historic vaccination effort for 5 weeks, and people are working every day on this issue at every level of government. In Howard County, we have received a little more than 17,000 first doses to date, starting on December 23rd, when we received our first 100 doses. For the subsequent 3 weeks, we averaged about 2,500 doses per week, and 4,500 was the height during 1 week. Unfortunately, this dropped to 2,000 last week, and this week we will only receive 1,700. We now have more than 100,000 people in Phase 1B who have filled out a pre-registration survey to say they want the vaccine. We currently do not have enough vaccine. We will vaccinate through phases as defined by the governor. And we have approximately 15,000 individuals in Phase 1A, including our healthcare providers and first responders, and have since started vaccinating Phase 1B, adults 75 and older, educators, our developmentally disabled population, and continuity of government. There are three streams of vaccine distribution in Howard County. The first is our local health department. The second is our hospital, Howard County General Hospital, which is in the Johns Hopkins system. And the third are pharmacies and grocery stores. More than 8,000 of our residents age 75 plus have been vaccinated across various streams. And this is nearly 50% of this senior population according to our census data. In addition, private and public educators are being vaccinated. And our public school system has provided a prioritization list to partners to move through that vaccination process. Right now, we anticipate second doses to continue being allocated on time. For those of you who have received a first dose, we are confident that you will receive your second. Due to our limited supply, we're having people fill out a pre-registration survey with contact information. Then, as soon as we receive vaccine, we can schedule appointments for those who have pre-registered. At this time, anyone can pre-register. That includes phases 1A, 1B, 1C, as well as phases 2 and 3. Pre-registration surveys are available for every phase and is on our website. Giant and other pharmacies are vaccinating residents 65 years of age and older, and appointments can be made on marylandvax.org. We're doing everything we can to advocate for additional supply, streamline the processes, and centralize distribution. We built infrastructure here in Howard County to administer more than 20,000 doses per week and have consistently been one of the most efficient health departments in our state to administer vaccine. I know there's a lot of frustration out there, and please know I share your frustration. However, there are constant adjustments, progress, and setbacks, but we're all in this together, and we will get through this together. Thank you.
Thank you so much, County Executive Ball. For those who are joining us, again, if you have a question at any time, press 0 on your keypad to get in line. And right now, we're going to give an opportunity for our panelists to provide a 1-minute introduction, starting with our health officer, Dr. Maura Rossman.
Thank you, Angela, and thank you, County Executive Ball. I'm Dr. Maura Rossman. I am the health officer for Howard County Health Department. Howard County Health Department is one of 24 local health departments in the state of Maryland. We are the cornerstone of this vaccine rollout and have been managing the pandemic response for now a year. I think it's truly remarkable that we are having this conversation and discussion tonight because it means that Operation Warp Speed was a most amazing miracle that delivered 2 vaccines to us right now that we are administering to our Howard County residents. Hopefully, more vaccine is on the horizon, and we can discuss that tonight about current and future planning for vaccinating everyone who deserves vaccine and wants vaccine. Thank you.
Thank you so much, Dr. Rossman. We'll now hear from our superintendent of our Howard County Public Schools, Dr. Michael Martirano.
Thank you, Angela. Good evening. I'm Dr. Michael Martirano, Superintendent of Schools for the Howard County Public School System. I appreciate the time provided to speak directly with Howard County residents this evening. As many of you know, and as all of you know, the topic of the COVID-19 vaccine is of great interest as we prepare for a return of students to in-person instruction beginning on March 1st. I just want to commend, and I'm grateful for the efforts of Dr. Rossman and her team at the Howard County Health Department, who have already supplied over 1,000 first doses of vaccines to the Howard County Public School System employees by the end of last week. Additionally, a newly formed partnership with Johns Hopkins Medicine resulted in approximately 550 vaccines being scheduled last week. And I thank Dr. Ahmed for your thank you for allocating this to us. Late yesterday, we learned that the Howard County Health Department had allocated 500 vaccine doses this week to the Howard County Public School System staff. In addition, Johns Hopkins Medicine has allocated an additional 500 doses to the Howard County Public School System staff. To date, this brings the total number of vaccines made available to Howard County for our staff to 2,650. But also, we have also been polling our teachers and our staff members to see how many of them have received vaccine outside of the county. And today I've learned that 911, an additional 911 staff members have indicated that they've received their vaccine or are scheduled to receive their vaccine from a pharmacy, from their doctor's office, or one of these statewide vaccine distribution centers. This brings our total to about 3,565, which represents 35% of our workforce. I look forward to participating in this town hall and answering further questions this evening. Thank you very much.
Thanks so much, Dr. Martirano. We'll now hear from Dr. Shafiq Ahmed, Interim President of the Howard County General Hospital.
Thank you, Angela, and good evening, everybody. I'm Dr. Shafiq Ahmed. I am the Interim President of Howard County General Hospital, part of Johns Hopkins Medicine. Since the beginning of the pandemic, we have been focusing on our primary mission, which is to take care of all of the patients of Howard County that have COVID-19. And to date, we have taken care of over 3,000 patients and approximately 1,100 to 1,200 that have been on our inpatient side. So we have been here and steadily fighting against COVID-19 and a great partner in the pandemic in terms of our response. As of late, we have also shifted our responsibility to help distribute vaccinations. Although we are not distributing as many as our Howard County Health Department, we are still taking part. As Dr. Martirano noted, we are assisting in the past few weeks with teachers and with members of the population that are older than 75. So we are happy to be a partner in this fight, and we are happy to help out in any way necessary. Thank you.
Thanks, Dr. Ahmed. And we're pleased to be joined by Maryland State Senator Dr. Clarence Lamb.
Thank you, Angela. Good evening. It's a pleasure to be here. I want to thank County Executive Ball for organizing this as well, and also bring greetings from the county delegation as the chair of the Howard County Senate delegation. This issue is incredibly important to all of you, also me as well. Many of you might know, but I'm also the only physician serving the Senate of Maryland and also a physician at Johns Hopkins, where I still see patients every week and currently serve as the interim director for occupational health for Johns Hopkins Medicine, working to ensure some of our 500,000 frontline healthcare workers remain safe. But to be clear, I'm not speaking on behalf of Johns Hopkins. As you can imagine, it's been a remarkable 11 months eating, breathing, and living COVID since March. Not only is my role as a physician, but also in the legislature. Since the spring, we've had a joint COVID-19 legislative work group that's been working on issues like testing, contact tracing, unemployment benefits, and reopening our schools. We've also, in the last few weeks, set up a Senate vaccine oversight work group where we have weekly meetings with the acting secretary to stay on top of the distribution of vaccines throughout the state. In the Senate, I serve on the Education, Health, and Environmental Affairs Committee, and I want to just close by saying that there is light at the end of the tunnel, as the county executive mentioned. We ask that all of you please bear with us, remain patient because the supply is short, but this is the number one issue that we've been hearing from our constituents, and getting vaccines rolled out to residents is absolutely essential in getting folks back to schools, businesses open, restaurants back in business, the economy restarted, and back to our normal lives. So there's no issue that's more important. We're all working hard to make sure that our state delivers. Thank you.
Thank you, Senator Lamb. We'll hear from Chief William Anashevsky from the Department of Fire and Rescue Services.
Thank you, Angela, and good evening, everyone. Thank you for being here with us. I'm Bill Anashevsky, Chief of the Department of Fire and Rescue. And since the beginning of the COVID-19 pandemic, Fire and Rescue has been engaged in the frontline operational response. To date, we have vaccinated just under 400 of our operational frontline personnel that have requested the vaccine. And we are now well into our second dose phasing of emergency personnel, and I'm happy to report that we have not experienced any unexpected reactions to the vaccine. And while operational response is still our primary mission, we are shifting some resources to assist in the vaccination process. Department personnel have been assisting with the second dose vaccines for the 1A healthcare group, as well as assisting our partners in the health department with initial doses in the 75 and up group during those clinics. And tomorrow, Fire and Rescue's mobile integrated community health team will pivot its mission to begin vaccinating specific homebound at-risk groups throughout the county. Thank you.
Thank you. And finally, we'll hear from Director Jackie Scott from the Department of Community Resources and Services.
Good evening, and thank you, Angela. Good evening, everyone. It's a pleasure to be here with you. The Department of Community Resources and Services is the human service agency for Howard County. And in this effort, we've been focused on access. We've been laser focused on access related to 3 areas: making sure that there's reliable and accurate information out there, and we can talk to you a little bit more about that, so that you can make the kinds of decisions you need with regards to your family and your health care with regards to the vaccine. The other is making sure that the information is getting to everyone and that everyone has equitable access to the vaccine itself, so that things like socioeconomic status, race, culture, geography, disability status, none of those things should be barriers to accessing this vaccine. And then third, the literal physical access, whether it be online and managing the online portal or assistance when you're on site in getting the vaccine. So we have people available and we're assisting. So our focus right now is increasing access and ensuring that we're able to reach everyone. So I'm happy to be here this evening and to be able to talk with you more about that as we go forward. Thank you, Angela.
Thank you, and thank you again to all of our panelists who are joining today. Before we jump into that Q&A, we want to hear from you. Dr. Ball is going to start by beginning our first poll.
Thank you so much, Angela. So our first poll question is, are you planning on taking the vaccine when it becomes available to you? Are you planning on taking the vaccine when it becomes available to you? If yes, please press 1. If no, please press 2. 1 for yes, 2 for no.
Excellent. We are seeing some great participation here on that poll. And now we are going to go into hearing from our participants and hearing some questions live. Before we do that, I just want to do a reminder that if you have a question at any time, just press 0 on your keypad to get in line. Our first question is going to come from Jennifer from Glenwood. And right now, Jennifer, you are on the line.
Yes, hi. My question is, how is the county helping at-risk seniors, those that are above 75 who are mobility restricted and cannot wait in long lines or stand for extended periods of time? Are there drive-through facilities, or how is the county helping those kinds of seniors?
Great question, and I think it's particularly important given that that is our priority group. And so we are looking at not only a partnership, and I'm turning it over to them soon, with our health department, led by Dr. Mara Rossman, but also within the Department of Community Resources and Services, led by Jackie Scott, is our Office on Aging and Independence. So, ladies, I'll turn it over to you.
Hi, Jennifer. Thank you for asking that question. And that's a great first question, because the response you'll see will show the enormous partnership that is going on within Howard County to ensure that those individuals with mobility issues are able to access vaccine. This includes Department of Community Resources as well as our mobile integrated health team that Chief Anashevsky mentioned. But I'll start with the health department. So right now, with individuals with mobility issues, if you have a clinic appointment on site, we generally have staff who will ask when the car pulls up if there is a person with mobility issues, and we have the ability to actually vaccinate persons in their car rather than persons having to go into the building. In addition, let the chief talk about the mobile integrated health, which will launch tomorrow, as well as other accommodations that we have on site for those that are able to at least ambulate somewhat but need assistance. And Jackie Scott may want to talk about that. So I'm going to turn it over to the chief to talk about the mobile integrated health.
Sure. Thanks, Angela. So tomorrow we'll be launching 2 teams of 2 people with one health department person with them as well. We will have specific addresses of people who are homebound through the health department that we will be able to start vaccinating in their homes. So that takes the helps to assist with the mobility issues of getting somebody out of their house who either cannot ambulate at all or has a great difficulty ambulating, and we'll continue to grow that group as we work through the process.
Thank you so much, Chief and Dr. Rossman. Also, Director Scott, would you like to add anything?
Yes, thank you. Just very briefly, for those who do come on site, if you are familiar with some of our services at the Loan Closet, you know that we have equipment available for the public to be able to use. So we have wheelchairs on site at the vaccine site and staff available to meet you at your cars if you identify yourself. And even if you are bringing your own wheelchair or have crutches or anything else that needs assistance with mobility, we have staff that can help get you from your car, if you choose to do that, to come on site into that location. When you call to make your appointment, or if you need or have questions, you can reach us on our Maryland Access Point line, and there's Maryland Access Point staff on the lines with the health department to help with those kinds of questions and to make sure those needs can be taken care of.
All right. Thank you all, and thank you, Jennifer, for asking your question. We're now going to take a question from Mark. Mark, you can ask your question live.
Hi, this is Mark Condon, and actually I'm going to let my wife Laura speak because she might be a little better at asking the questions.
Hi, this is Laura Condon, and my husband and I are both in the 65 to 74 age group, and we have signed up on the county website. I have a couple of questions. I guess I can only ask one.
Please feel free to ask a couple.
Okay, thank you. Okay, so the first would be just waiting on the county. When do you think we'll be in the queue? Do you think it will happen in February or it will happen in March?
Well, I think, and I'll start off and then turn over to Dr. Rossman. I think our biggest challenge is the amount of vaccine. We're able to do 20,000 a week, but we've only gotten 17,000 vaccine. And just in phase 1A, which is, for example, emergency personnel, what have you, is 15,000. And so we are trying to work with our various partners, the hospital, and I think we've seen from not only the federal but state administration, both of those entities really want to ramp up our various private pharmacies. And so we're actually getting diminishing vaccine from the federal and state government. But we are very hopeful that as we see other vaccines get approved and as we see production increase, that will be accelerated. However, our older adults are a priority. And Dr. Rossman, do you have anything to add?
Yeah, Laura, the only thing I'll add is right now the state of Maryland is receiving about 88,000 doses for the entire state per week. And what the state is reporting is that they should expect that to be more or less the same for the next couple of weeks until hopefully the Johnson & Johnson vaccine is approved. So I don't have a crystal ball, but I'm certainly hoping that in March we have another vaccine, a vaccine that, by the way, is only one dose, that will really open the market up to more and more people being eligible for vaccination.
Okay, so you both have answered that question, which leads to my next question. In reading the email from Calvin Ball today, and the fact that the doses we're receiving are decreasing each week, it seemed to me it was encouraging us to go to the state of Maryland site, which I did go to. However, there's the Six Flags site, which is for PG County residents. There's the Timonium site, which is for Baltimore County residents. There's the Convention Center site, which does not seem to be restricted, but did ask whether or not you were a resident of Baltimore City or Baltimore County. So there are these mass vaccination sites, which it seems that the doses are being funneled to rather than to the county, because the county is receiving less. So that's my second question. Then it leads to a third question is, we're not in PG County, we're not in Baltimore County. What kind of mass site are Howard County residents eligible to sign up for, since our own doses are diminishing each week? It seems we should, look for other options. Where should we look? I mean, I did sign up for the convention center, but because I'm not a resident in Baltimore City or Baltimore County, I think I'm probably one of the last in line. And I did go to Rite Aid and to Giant Food, and none of those are taking appointments because they just say keep checking back. So where should we go? Where should we get in line?
Thanks, Laura.
Thank you. That is the crux of a lot of the questions that we're getting. I have been advocating, and I've talked to numerous officials, including our acting Secretary of Health, the governor, even Senator Van Hollen, about what I believe should be a course of action, which should be the focus, should be on our local health departments and our hospitals. While we have so limited vaccine, I think it helps have a clearer message. It has an easier place to go. And our health departments and hospitals have demonstrated proficiency in not only delivering the vaccine, but doing it in a safe way where there's physical distancing and all of the important parameters. However, I think the state and the federal government have a different thought. Their belief, as I understand it, is that they want to have the ability to get vaccines so prolific throughout any place in the state that people can go everywhere. And at this time, they are working to build that infrastructure. I have requested that be moved forward if that is the approach after we have sufficient vaccine. That at this time, when there's so little, that it becomes more confusing. However, I definitely understand their approach. And I think at this time there is some confusion. And I'd also like to turn it over to Senator Lamb, because I know he is working on this issue not only as a physician, but also as a Maryland State Senator.
Yeah, thank you, County Executive. Laura, and thank you for your question. I certainly share your frustration. This question that you brought up was actually one of almost exactly the same question that was brought up today before the acting secretary, before the Senate Vaccine Oversight Work Group. And unfortunately, you know, the response from the department has been that constituents that have this concern, that have this problem, should try to sign up on as many waiting lists as possible. We've pointed out that, you know, we hear from constituents like yourself and many others that this is really an untenable situation where they're turning to local health departments, they're turning to Walmart and CVS and Walgreens and, you know, Hopkins and other websites to try to register, and it's really becoming difficult. We are trying to impress on them the real need to have a single portal or a single site where someone gets in line once and they can be queued up for whatever vaccine is appropriate and available to them. There's been a real reluctance on this point so far from the Maryland Department of Health. I think they were really trying to approach this from a decentralized structure, as the county executive mentioned. We're continuing to impress on them the need to be able to have some kind of a single sign-on point, because it really does create a setup for many constituents that are expressing the same frustration as yourself, and we'll keep impressing on them the need to do so. We're hoping that as the vaccine becomes more available, this will help resolve some of that frustration and backlog too, but I think the planning still needs to be in place for once the availability loosens up, that demand is still being queued up properly through some single portal, with one single line being created for constituents and residents to be able to line up through. I think the current situation is creating a lot of confusion, and that's what you're seeing expressing right now. So we're going to stay on top of the department to continue working on this.
Thank you, Laura,
Okay.
Mark, and Senator Lamb and County Executive. We're going to go take another question, but we just want to thank you for getting on.
Oh.
Okay, we are moving to Ingrid. Ingrid, you can now ask your question.
Hi, my name is Ingrid Gleistein, and my question is more regarding the vaccine itself rather than distribution. After receiving the second dose of Moderna vaccine, I understand that the side effects can be debilitating, and some of them can include fever, chills, headaches. While you're undergoing those flu-like symptoms, are you able to transmit the disease to other members of the family who have not yet been vaccinated?
Great question. I'll turn this over to Dr. Rossman.
Hi, Ingrid. That's an awesome question. And yes, you're absolutely right. I've had 2 doses of the Moderna, and after my second dose, about 24 hours later, I didn't have fever, but I felt chills and a headache and didn't feel quite right. That is an indication that my immune system is ramping up, that the vaccine is working. I was able to go to work that day. I didn't miss work. I didn't feel 100%, but actually I felt 150% was like, okay, the vaccine's working. The vaccine is not a live vaccine, so you cannot get COVID from getting this vaccine, either a first dose or a second dose, and you can certainly not infect anyone else by getting the vaccine. I encourage everyone to really strongly think about getting the vaccine, certainly understand the side effects so you know when it's happening and you can address it, and weigh the risks and benefits for you and your family.
Thank you.
Can I chime in too? Can I add to that? This is Senator Lamb. 2 quick points. I think one, it's still important to use the precautions that you're using in place right now to socially distance and continue to wear a mask, because number one, our scientists have shown that, conveyed to us that it still takes about 2 weeks to build up full immunity. And so, you know, for that 2-week period, you're not, you know, seeing the 95% efficacy that you would ordinarily see in those vaccines. So it's still important to continue to mask and social distance. Number 2, it's still important to undergo those precautions because the vaccine has been shown to reduce the likelihood that you would get hospitalized and reduce the severity of the disease. but it's not clear yet. They're still trying to do studies on whether or not the vaccine will block the transmission of COVID from one person to another. And so there's still potential risk that you could infect others, even though you don't show visible signs and symptoms of it after you've gotten vaccinated. So for that reason, it's also still very important to continue wearing a mask and maintain social distancing.
Thank you.
Thank you, Ingrid, and thanks, Senator Lamb and Dr. Rossman. We are now going to Jennifer from Columbia. Jennifer, you can ask your question. Jennifer from Columbia, you're on.
Oh, sorry, thank you. So my question is, if you're a county resident, but you're a public school teacher in a different county, how do you go about getting the vaccine, and are you eligible to get the vaccine in this county?
Thank you. I'm going to start off with Dr. Rossman and then Dr. Martirano if he wants to add in too.
Hi, Jennifer. So what the state has decided that if you are a public school teacher, you will be vaccinated according to the policy of your employer. So currently in Howard County, Dr. Martirano is managing the prioritization of Howard County Public School employees regardless of where they live. So I would refer you back to your employer. Dr. Martirano?
Jennifer, good evening. The only thing I'm disappointed in is you're teaching in another county and not Howard County as we continue this conversation. But Dr. Rossman has answered the question regarding how we have prioritized with what we're calling our own closed pod, which is all of the Howard County Public School System employees. And Dr. Rossman has answered that effectively. Thank you.
Thank you so much.
Thank you, Jennifer. We're now going to Valerie. Valerie, you're on the line.
Thank you. My question is, how do you register for a vaccine from, say, CVS? And once you do that, do they accommodate for people who are physically challenged?
Thank you. Great question. We'll start off with Dr. Rossman, and I'm not sure if someone else will be able to or need to chime in.
Hi, Valerie. So should go to the Maryland website, which has a vaccine locator, and you would find the nearest CVS to, I guess, your home address or wherever you might want to be vaccinated. You would click on that link, and then you would follow the directions that the CVS says. As I understand it, most of the retail pharmacies are requiring registration online. I am not aware, but it just may be that I'm not aware of any accommodations that they are making for vaccinating once you are in the store.
All right, thank you.
Thanks so much, Valerie. All right, we're now moving to Marlene from Ellicott City.
Hello, this is Marlene Zendel from Ellicott City. My question is, I've had the first shot, the first Moderna shot, and I am scheduled for my second shot on February 16th, and I just want to know whether I can be sure that you're going to have enough vaccine for the second shot.
Excellent question, and I know that's on the top of a lot of people's minds. I would like to say yes, but I'm going to turn it over to Dr. Rossman in case there are any caveats that I may have forgotten.
Dr. Ball, you're spot on. Say yes, the vaccine's sitting in the fridge waiting for you, Marlene. See ya.
That's wonderful. Thank you very much. I'll share that with my husband. We're both coming.
Thank you.
Thank you. All right, we also now have Edward. Edward?
Yes, good evening. Thank you very much, everyone. My name's Ed, Ellicott City, and I have a company that is a residential appliance repair company with about 15 folks. And just as a segue to that, I'm also affiliated with about probably 50 other companies in Howard County and surrounding areas that are also residential service companies, whether it be painting or electrical or plumbing, et cetera. To that extent, who would we talk with to determine if our companies, service in homes, kind of as an essential company, if we would qualify or if our employees would qualify as a 1C phase, 2 phase, or phase 3? And then there's a second part to that question as well. Is it possible for those folks that are living outside of the county, and I kind of heard this earlier, is it possible for them to register then in Howard County to go ahead and get their vaccine here if they're living, say, like in Carroll County, Frederick County, Baltimore County, et cetera?
Wonderful questions, and I'll start off and then turn them over to Dr. Rossman. Let me start with just first, things continue to evolve, especially as vaccine comes online. The governor has set the phases and those who are actually included on those various phases, and I think that there's a great deal of detail in phases 1A, 1B, and 1C, and then less in 2 and 3, but probably because we haven't really gotten anywhere near enough vaccine to get to those places. And then I'll turn it to Dr. Rossman for any more details.
Yes, thanks for that question, Ed, and thank you for what you and your company and your employees do to keep us running, right? All of us running. As the county executive said, things change, things evolve, definitions change. I would say right now that your company workers would be considered essential workers in phase 2. Rather than 1C. And as the county executive mentioned, that is subject to change, and certainly when more vaccine becomes available, I'm hoping all of this, what phase are you, becomes moot so that you can just go and get vaccinated.
And that's the way I kind of read it as well. I just wanted to make sure that I interpreted the information online correctly, so as I pass it on to our folks, that I can direct them accordingly. And then I would also imagine too, as you're saying, if as you complete phase 1C, you're going to delve into phase 2 anyways. But then if you need to basically speed things up, I'm sure you'll reach out to folks in the phase 2 to go ahead and pull them up. Is there anything that they need to do special in order to go ahead and basically indicate how they would qualify as phase 2, other than just saying that they work for an appliance repair company or any type of service company, if that's what they're doing? And do they have to have proof of the such that I need to provide to them that they would provide to you?
Well, right now we're I'm sorry. Go ahead, Dr. Rossman.
I'm sorry. You can go ahead.
I was just going to say right now we're pre-registering in phase 2. And it is, again, my hope that as we see more vaccines come online, as Dr. Rossman indicated, a lot of this phasing will become less important. However, at this point, if people can pre-register and go through the process so that we can have you on the list, and then as we move through phases 1A, 1B, and 1C, and we get into phase 2, we start connecting with people. And again, things will continue to change and evolve, especially, and we thank you and all of your essential workers for all that you're doing. Things may come online, and as the federal and state governments are building up different infrastructure, they may actually allocate different folks to different entities. For example, there might be a focus on one group or a phase with the hospitals, or one group or phase with our pharmacies, or one group or phase with our local health department.
Thank you, County Executive, and thanks so much, Ed, for calling in.
Yes.
All right. We're going to continue on and moving through. I want to give the results of our first poll. The question was, are you planning to take the vaccine? 97% of you said yes. I'm sure a lot of people on the call are happy about that. 3% said no. I'm going to turn it to Dr. Ball for the second poll question, and we'll get more into Q&A.
Thank you so much, Angela. So, second question is, besides the lack of current supply, what are your biggest concerns about the Howard County and state of Maryland vaccination process? And again, besides the lack of current supply, what are your biggest concerns? Please press 1 for lack of communication about safety of vaccines. Please press 2 for lack of clear registration process to receive vaccines. Press 3 for concerns about the vaccine being distributed equitably. And finally, press 4 for concerns about how long it will take to reach herd immunity. Again, press 1 if your biggest concern is lack of communication about safety of vaccine. 2, lack of clear registration process to receive the vaccine. 3, concerns about the vaccine being distributed equitably. And 4, if your biggest concern is concern about how long it will take to reach herd immunity. Angela, back to you.
All right. Thanks so much, everyone, for engaging in the poll. Again, if you have a question at any time, just press 0 on your keypad and you can get in line. Now let's take the next question. We have a question from Jay in Columbia. Jay, you can ask your question.
Hi, thank you. I'm just, quick question, 62, and I have diabetes and some other things. And I assume I'm in phase 2, is that correct?
Well, it depends. If you are immunocompromised, I think we're in phase 1C for you.
Well, I'm not in a hospital or anything like that. So that's my question, I guess. I thought, in looking at it, that if you're, 16 to 64 and you're not in a hospital facility, that would be phase 2.
Yes, likely that is the case. Dr. Ahmed, can you talk a little bit about the criteria by which you evaluate immunocompromised and the hospital connection?
Sure, Dr. Ball, and thank you for the question. And so right now, I think, based on your assessment, you probably are not in that immunocompromised category. That category is reserved for patients that are receiving cancer treatments, most likely, anyone that is receiving chemotherapy or has any other type of condition that would lead them to be in the condition that we call immunocompromised, which means that their immune system is not working well. And so those are usually the things that we'd be looking at. Things like diabetes and high blood pressure and other conditions such as that are chronic diseases, which are different and not quite as high risk as people that are immunocompromised. The risk for them if they were to get COVID is much more severe, and so that is one of the reasons that they are prioritized to be a little bit higher.
So I'm probably phase 2.
Correct.
And having said that,
right.
If I do the pre-registration survey, at that point I just wait for further information?
Correct.
Okay. All right, that was it. Thank you.
Thank you.
Thank you, Jay. And thank you to all who answered. We are now going to Joe from Glenwood. Joe?
Oh, hi. This is Joe Carter. Am I the right one? Am I the right Joe?
Yes, that's you. Yes, no, you're the right Joe.
Okay. I don't like to be the left Joe. My question was, how safe is it for the my age at 85? I'll be 86 in a couple of months. How safe is that? I mean, do I have to worry about taking the shot? One of my grandsons down in Florida says he doesn't think I ought to take the shot, but my wife and I, we think we should take it.
Well, fantastic question. Thanks for calling in. I think vaccine hesitancy is actually something that's pretty common, and I will turn it over to whoever wants to answer between Dr. Rossman's, Dr. Lamb, and Dr. Ahmed.
I'm happy to start. You'll have three doctors providing you opinions, Joe. So the first thing, I applaud you even thinking about it and entertaining different opinions from, I think you said your grandson or your son and your wife. Both of these approved vaccines, the Moderna and the Pfizer, have really been rigorously studied by the FDA and deemed to be safe for all the age groups for which they are authorized. The Moderna vaccine is authorized for adults 18 and up, and the Pfizer for 16 and up. So I think it's a highly safe and efficacious vaccine that everyone should consider. I think you might want to have a chat with your personal provider, because I don't know any individual health issues that you may have. You sound really quite healthy and robust, but I think that's worth a conversation with your trusted provider as well. But I encourage everyone to really seriously think about the vaccine, and especially as we age, the risks of COVID disease really are quite high compared to the risks of the vaccine. So for me, the benefits of vaccination really, really outweigh the risks. I don't know if Dr. Lam or Dr. Ahmed want to weigh in as well.
Dr. Rossman, this is Dr. Ahmed, and I want to echo what Dr. Rossman said. It's definitely an individual choice. However, I think when we look at the safety profile of all the information we have today, the safety seems pretty good, and it seems like it's an effective option. When we see everything that we know about actually getting an active COVID-19 infection, the safety is really not so good, and the risks increase as you are older and if you have other conditions. And so I think that's one of the challenges, is that people do need to weigh those two things out. And although you still have to even if you get vaccinated, you still have to wear a mask and follow precautions, the risk of having severe disease and death from COVID goes down incredibly. So I think that's very, very important to know, that the vaccine benefit does outweigh any of the other risks it has.
Thank you. Thank you. Thank you very much.
All right, thank you so much. We are going to now go to Jerome from Glen Elk. Hi, Jerome.
Good evening. Good evening, and I want to thank you very much for getting this panel together. My question is quite simple, and I think it's been answered by somebody else, or asked and answered. But I recently received my first shot it was a Pfizer shot. It was Howard Community College, and that went over quite well. Not quite well. What happened was I received an appointment, and I decided to go there just a little bit ahead of time, so I would be there on time, and ended up in a line that I was waiting in for 2.5 hours. Okay, only to find out somebody came out and said we're not honoring the appointment, so the whole appointment thing went out the window. I did get the shot, and I will be getting another shot due on. I have an appointment for February 20th. Now, and I have a time at 2 o'clock. So, do I go at 2 o'clock? Do I go at 10 o'clock in the morning and hope that is it going to be the same thing with the lines and lines of people and the appointments not being honored, or what? I don't mind. I'll go at 10 o'clock in the morning, but to say come at 2 and then end up going at being seen at 6 is not exactly what I would call a great experience, because I'm standing out there in the cold. So that's my question. And number two, if depending upon the fact that the vaccine is going to be available on the 20th, if not, what happens if it isn't? And I've already received the first shot, and I'm supposed to receive the second shot in some interval of time. Is there anything that would keep me from having to go back and do the whole thing over again, or how does that happen?
So I'll start off, and then I'll turn it over to Dr. Rossman. First, I'll take the second part. Yes, we have your second dose, and we'll make sure that you get it in the appropriate amount of time. And second, to the first portion, I would just want to personally apologize to anyone who was inconvenienced during that time. We are continuing to build our infrastructure, and we definitely recognize that during a cold time, people were just waiting too long, and I personally apologize for that. However, our team has continued working on evaluating that, improving the process to help ensure that that doesn't happen again. Dr. Rossman?
Yes, thank you, Dr. Ball, and thank you for that question. And again, apologies. I wrote down a word that Dr. Ball mentioned in his opening remarks. We've had a lot of progress and we've had a lot of setbacks. And that weekend is, I don't want to call it a complete setback, but certainly was not satisfactory to about the 3,000 super seniors who were vaccinated over the course of 2 days. That was our first week at HCC. That was our first week of managing the Pfizer vaccine that you got. None of this really makes any difference because you were standing in the cold too long. But we've heard from a number of people and have immediately made plans so that this doesn't happen again. So we have changed our line structure and added more staff to the outside so that no, don't come at 10 o'clock in the morning. Come at your appointment time, just like go to your doctor now, right? All of us, when we go to our doctors, they have us wait in our cars until the appointment time. Exactly. And we'll be, even if you come early, because I know sometimes I want to get there early just to make sure I don't get in traffic, line control will tell you to wait in your car until the right time so you're not waiting outside. Inside, second dose registration will go much quicker because we already have you. We know we have your second dose waiting, so that should go smoother as well. We've enhanced our staff and actually equipment to help with, it doesn't sound like it's you, but with our super seniors with mobility issues so that we can get them vaccinated as easily, comfortably, with dignity. We've changed the floor within 48 hours of HCC. I don't know if you noticed, I hate to bring it up, but they had a covering that wasn't really quite smooth and we were worried about a trip hazard. That has been all changed and we're adding porta pots. So we're trying to make everything as really comfortable by adding these amenities so that your second experience is much better than your first.
Well, thank you very much.
Thank you.
Thank you, Jerome. We're now going to Tracy from Columbia.
Hi. I'm wondering, can we have a choice of which vaccine that we can take? And that's one of the questions. And the second question is, I don't know if I heard that the doctor's offices are not giving the vaccine to us. And I don't have a computer or a smartphone, so I don't know how to get online to do that. So I'm wondering, do they have a phone number so we can call in that can help us get online?
Great question. I'll start off with Dr. Ahmed and then transition to Dr. Rossman.
Can you repeat the question again, the very first question you had in this?
Do we have a choice of which vaccine we can take?
So what I'll say is that when you come, if you are asked to come to Howard County General Hospital, we do not give a choice. It is really based on which vaccines are available. And so when we have a certain type of vaccine, that is the vaccine that we are offering. We do not have the luxury at this point of giving a choice based on the limited number of doses that we have. And then you had a second question.
The second was the doctor offices are not giving the vaccine at all.
Yeah, so one of the things right now is that that is not a distribution channel, as we call it. Doctors' offices for certain types of vaccinations, like the brand Pfizer, it requires a special deep freezer that most other facilities don't have, so it's very restrictive for them to be able to do that. And based on the limited supply at this time, is not available in doctor's offices, but that may change in the future. But at this time, that is not the place that we are handing out vaccines.
Okay. And another question is about trying to, if you don't have a smartphone or computer, how are you supposed to get online to get the shot? Do they have a phone number that we can call?
So without a computer, that is a little bit more challenging. And I'm going to give this back to Dr. Rossman to see if the county has a phone number versus getting onto the computer.
Hi, Tracy. You're not alone in not having a computer or maybe not even being comfortable with using a computer. We do have a phone number, a couple of phone numbers that you can call, the MAP line that Director Scott mentioned, as well as a health department line. And I don't know if Angela or someone else can provide that to Tracy.
We actually have it for those of you who are able to see. It's on our Facebook Live. And for Tracy, it is 410-313-6284. And so we can definitely make sure that we take your call. And I'd also like to pass it over to Director Scott for any insight that you have on this and mobility issues.
Absolutely. Thank you, Dr. Ball. And thank you for your question, Tracy. We have people, I'm going to give you two other numbers just so that you have a number of resources. We have the care line, which is also a place that we can assist you, 410-313-2273. And for those who also don't have the MAP line, which is the Maryland Access Point, that is 410-313-1234. And so we have people who can help you right there, log onto the computer with you. You can give us the information, we can put it in, and we can make sure you get it. In addition to whether or not you need any additional services at that time. So we're happy to help you with the person there.
That's good. So one more thing too. I'm 61 years old. There's no way I'm even near having a shot no time soon, right?
There might be some other issues because in phases 1B and 1C, it doesn't just look at age. However, if it's just exclusively about age, you're likely going to be in phase 2.
Phase 2? Okay, what phase are they in now?
Well, so we started off in phase 1A. Phase 1A had 15,000 people. However, due to vaccine hesitancy, what have you, there were some people who are cycling in now who weren't interested or able to before. We're primarily in phase 1B, which is about 100,000 people. And so we're working through that. And then we have in phase 1C, we're going to prioritize our older adults 65 to 74.
All right, Tracy, and thank you so much, Dr. Ball. Thank you for answering, and many others. We are going to now go to Bill. And Bill from Columbia, you can ask your question. Bill? Bill W. from Columbia?
Yes, I'm here.
You can ask your question. You're on the line.
Okay, good evening, everybody. Thank you for accommodating us. My question is, I understand Governor Hogan's intention in getting teachers back in schools so that we can get students back in schools, but what measures and what priority are these teachers getting to get their vaccine? I happen to be married to a Howard County teacher. She's called the health department, and they've advised her that her vaccine needs to come through the school system, but she's gone through the school system, and there's no vaccines available. So I'm just trying to figure out, County Executive Ball and Dr. Martirano, what priority is being given to these teachers before February 22nd.
Great question. I'll start off and then I'll turn over to Dr. Martirano. As Dr. Martirano indicated earlier, the school system, which is the largest employer here in the county, actually is operating under a pod system where they have prioritized vaccines. And so we're working through that prioritization. And I'll turn it over to Dr. Martirano for more detail.
Hi, Bill. Thank you for your question. Before I start, tell your wife thank you for all that she's done and what she continues to do for our students. I greatly appreciate it. Bill, as you can imagine, the same issue that everyone has talked about tonight is a matter of supply and demand. And we have been very fortunate to be able to have such a good partnership with the health department and the hospital. To date, we have developed our own tier system within our closed pod, and we have 4 different tiers, Bill. And let me review that since I haven't had the opportunity to do that. First, our first tier was for our healthcare personnel, meaning all of your wife's colleagues who are nurses within our school system. We have about 137. Those individuals received the vaccine first because they also served as inoculators. Our wonderful nurses are the ones who are out there providing the vaccines at the centers devoted to our employees that have occurred already at Howard Community College, and another one will occur on Friday. The second tier for us is also for the personnel for whom it has been mandatory to work in buildings. And Bill, that makes up at about 1,100 individuals. With the vaccines that we've had thus far, we've been able to move through effectively through tier 1 and tier 2. I'm very pleased about that, but as we are now in tier 3, which means that as the vaccines become available, then we are sending out emails based upon the number of vaccines available. For example, today we received 550 from the health department and 500 from Johns Hopkins. So today we provided another 1,000 vaccine appointments to our employees in tier 3, and we're sending those out at a time when our teachers can access them during the day. And we will continue to do so, although it is frustrating for your wife and for all of our employees. Again, I'm asking for patience as we move through this, as well as then recognizing the supply and demand piece of that. And then, Bill, the final tier is for all other non-school-based staff members, which would be central office. So my hope is that we continue to be able to get our vaccine in here with the cooperation which we've had to vaccinate all of our employees in a timely fashion. And to date, we have about 35% of our workforce vaccinated, which, as Dr. Paul stated, we are the largest employer in Howard County. So that's the information. Tell your wife to continue to read everything that I send out. We send out multiple communications on this topic. And again, thank her for her service.
Senator Lamb, I was wondering if I could add on to that as well. I think to Bill, we certainly share your concern on the state level. This was a concern that we had actually brought up with the acting secretary about 2 or 3 weeks ago before the vaccine oversight work group, in asking him, given the governor's recent urge to local school systems to reopen in-person instruction, if the Maryland Department of Health could assure us that educators that were going back into the classrooms could get a vaccine, that everyone that was needing to go back into the classroom could get a vaccine. And unfortunately, the Department of Health could not provide that assurance. We found that a little concerning. We're continuing to impress on them the need to be able to ensure that educators do get a vaccine if they are being pressed to go back into in-person instruction, just like the concerns that your wife has too. And want to also credit the county for being able to work closely with the county executive and Johns Hopkins in securing additional doses for educators here in Howard County, that it's not the state's Department of Health that's really stepped up to provide this, but through county leadership and partnerships that the county's been able to secure these additional doses to ensure that our teachers and other educators that are going back into classrooms have that vaccine before they go back in. And so we're continuing to work with the state on this. Certainly recognize the concern here, find their response somewhat troubling. We're continuing to work with them to see if that can be improved and additional doses can be provided to schools beyond what the counties have been being able to do.
Thank you, everybody, for the information. I do appreciate it. But real quick, one quick follow-up. Will Tier 3 in the school system, Dr. Martirano, be taken care of completely before we move on to Tier 4?
So again, that's going to be based upon supply and demand. As I've stated, we're well into Tier 3 right now. That is a large group. That's 8,500. So the possibilities of having everyone vaccinated by March 1st probably will not happen unless there is an infusion of additional vaccines to our county. But the other piece is, keep in mind, as we roll up on March 1st, not all of our students and all of our staff will be back on that particular day, in class instruction for our young people, and we're phasing that in as well over the course of 8 weeks. So as we continue to roll up for our students coming back, that we will also hopefully have more vaccines coming in. And I also want to impress upon individuals that vaccines are one piece of this, that we're taking all the precautions to keep our staff and students safe with the social distancing, providing the proper protective and equipment that we need, the PPE, as well as then the hand washing and all the other items that have to be in place and all working together to keep individuals safe. We just can't rely on the vaccine for that. All those other measures have to be there as well.
Absolutely, and I can't thank you and the staff enough for what you guys are, what you folks are working on now. But I guess my last quick question is, my wife is
Bill,
a GT
last
resource
question, because we have many questions in the queue.
but she doesn't have till March 1st. She has till February 22nd. So are we prioritizing which teachers are going to get the available vaccines versus the ones who are going to be teaching the high school students who are going to return last?
Yeah, Bill, that's an excellent question. Tier number 3, of which you're talking about, which your wife is in, there are 8,500 individuals within that group. As I stated, we're well into that right now. We will continue to move through that. There's no prioritization in there because everyone in that group is important. And so as we're doing the same process within the phases, it's very difficult for us to prioritize and make that determination and then excluding that to others, because every individual within that category can make a case of why they should. So we're continuing with the sending out the emails when we get the available doses. And I know it's frustrating with it again, but it's the supply and demand. And I appreciate, again, as I've stated, let me say this the final time, to all of our educators for them being patient and working with us through this process. And thank you for your question, Bill.
Okay, thank you everyone for your time. Sorry to go over. Have a good night.
Thank you so much. All right. We are going to do one more question before we get to our next poll. We're going to go to Rhea from Ellicott City. Rhea from Ellicott City, you're on. You can ask your question.
Hi, this is Rhea, and I wanted to ask, some of my original questions have been answered, but I wanted to continue along the school line with what are they doing to protect teachers? You mentioned social distancing and PPE. I wondered what the plans were for quarantining and ventilation. If you could talk a little bit about that, I'd appreciate it.
Thank you so much. So the county has actually allocated about $6 million of funding to help support the school system's efforts, and we all continue to work together. And so I'll turn it back over to Dr. Martirano for a little bit more of the details.
Thank you, Dr. Ball, and again, thank you for your leadership in providing the additional money that has allowed us to address some of the concerns of which is brought up. Ma'am, would you please state your name again? I didn't catch your name.
Hi, I'm Rhea.
Hi, Rhea. I really appreciate it. First and foremost, I've just posted on our website our document that is our Bridge to Normalized Instruction, the hybrid model for instruction for spring 2021. If you go to the Howard County Public School System website, you can click on a link that has all of that information defined in very, very explicit details. But regarding the issue of air quality and the issue of concern and ventilation, all of our schools and all of our offices have been retrofitted with the MERV filters that are necessary to provide the highest level of ventilation. We also operate under systems that take in the intake of our air, fresh air from the outside, that allows for better ventilation within. So we've taken all the necessary precautions to do what is needed for the CDC guidelines around ventilation with a higher level of the filters and airflow necessary within our schools. And we're very fortunate in Howard County to have support financially from our elected officials and our taxpayers that allow us to have the systems in which we do. Unlike other jurisdictions which are struggling in that arena, we've wanted to make certain as children return and staff return that is a top priority. The other issue that you bring up is extremely important to us are the standards around quarantining and what needs to occur in the event that an outbreak should occur within the schools, and that's another data point of which we are looking at as we proceed. And that information is outlined within the document that I've referred to as well. Dr. Rossman, and there's the 3 medical doctors on here, may also want to opine on that, but I direct you to the documents of which we have. In RIA, we've taken those issues into consideration as we return our students and staff to our school buildings. Thank you for the question.
Thank you, Ria. Okay, now we are going to give you the results of the second poll. That question was, besides lack of current supply, what are your biggest concerns about the Howard County and state of Maryland vaccination process? 5% of you said lack of communication. 63% said lack of clear registration process to receive vaccines. 18% said concerns about vaccine being distributed equitably. And 14% says concerns about how long it will take to reach herd immunity. We are starting to near the end, but we're going to turn it over to Dr. Ball for the third and final poll question.
Thank you so much, Angela. So for our final question, where do you get your Howard County vaccination information primarily from? Where do you primarily get your Howard County vaccination from? Please press 1 if it's calling the county or going to the county website. 2 for calling the state or going to the state website. 3 for social media. 4 for traditional media, or 5 for family or friends. Again, 1 if you get your vaccination information primarily from going to the county website or calling the county. 2, calling the state or going to the state website. 3, social media. 4, traditional media. Or 5, if you get your information regarding the Howard County vaccination process primarily from family or friends.
Thanks so much, Dr. Ball. We're going to take one other question, and this is from Laura. Laura, you can ask your question. Laura,
okay. Hi. Hi. Thank you. Okay, I have 2 questions if time allows. First is, I'm speaking on behalf of my father, who's over 75. He came to Maryland to receive treatment for an illness. So because of his illness, which is cancer, we didn't get any kind of ID at the MVA. So he receives mail. He lives with me. Can I provide other proof of residency to show that he does live here in Howard County?
We'll start off with Dr. Rossman, and then I don't know if Dr. Ahmed might want to chime in. Do you know if your father has, in recent months or years, been a patient at Howard County General Hospital?
Yes, he was admitted, unfortunately, during the course of his cancer treatment there. So I have records of that, yes.
So I'll start off.
So Dr. Ball, Dr. Ahmed, I can comment on one thing. Our system actually reaches out to people that have been part of the Johns Hopkins medical system in one way or another. So if you are randomized to the allotment and you're eligible based on the phase that we were in, that is what it would take to reach out to you either via email or phone. So we would probably not need those things.
Laura, you know, I'm sorry to hear about your dad. I'm glad he's able to live with you. My dad lived with me in Howard County for a while and kept his residence in New York. what we're doing at Howard County Health Department, he would need to put your address down, and we will be happy to vaccinate him as part of the super senior 75 and up.
Okay, great. Okay, thank you. And then my other question, I got him an appointment this Wednesday at Howard County Community College. He has mobility issues as well. So I was interested to hear about, how do I find this person that can maybe vaccinate him in the car? Like, how will that happen?
Great question. I'll start off with Director Scott and then transition over to Dr. Rossman for anything else.
Thank you, Dr. Ball. So a couple of things. When you pull in, and there will be staff that will ask you if you have mobility concerns, or someone in the car who's getting the vaccine will have mobility concerns. If you identify at that point, and Dr. Rossman will correct me if I'm in terms of the sequencing, but if you identify at that point, we can immediately direct you to that location on the parking lot where staff is then able to deliver the vaccine to you in the car. If for any reason you choose not to have that service there, as you progress into the site further and park, we can have staff escort you and your father with a wheelchair into the location. So we have two opportunities to provide service for you. Dr. Rossman, is that accurate in terms of the trajectory of the parking lot?
Yeah, that's perfect. Thank you.
And Chief Anashevsky, did you have anything else to add?
No, that's actually how it's being handled there at the HCC. So
Perfect.
Director Scott was hit the nail on the head.
Thank you.
Okay, thank you very much.
Thanks so much, Laura. All right, believe it or not, but we are at the end tonight, and I want to give you the results of that third poll. The question was, where do you get your Howard County vaccination information primarily from? 52% of you said calling the county or going to the county website. 23% said calling the state or going to the state website. 7% from social media, 9% traditional media, and 8% from family or friends. I'm sure that was surprising to some of you. Well, again, before I turn it over to Dr. Ball, I want to remind you to please stay on the line if we didn't get to your question tonight. It looks like there are still about 300 people waiting to ask a question, but if you stay on the line and record a message, we'll be able to get back to you. Also, you can email cball@howardcountymd.gov. There were so many great questions today that we just didn't get enough time to go through tonight, and we do want to hear from you. We thank you so much for joining us. We couldn't do this without all of you. I want to thank the panelists as well, and I'm going to turn it over to County Executive for any final thoughts as we wrap up.
Well, I wanted to echo Angela's comments. First of all, thank you, Angela, for helping to facilitate this process. For those of you who don't know, from our first case on March 15th of 2020, Angela has served as our incident commander, and we've talked almost every day about how to help people stay safe and get through this. And I think our panelists demonstrate the partnership and that this is all hands on deck to work through this challenging issue. And I want to thank them for everything. And I want to finally remind everyone, it's always darkest before the dawn. We are on the horizon with this new vaccine, with everyone working so hard of beating COVID-19. And I know it's frustrating, it's scary, there's a great deal of anxiety, but we will get through this together. Please continue to stay safe, stay engaged, stay informed, and hopefully together you will also stay empowered.
Thanks so much, Dr. Ball. Thank you to all the staff and all who joined tonight. This now concludes our virtual town hall. Again, please stay on the line after the event and you'll be able to record a message for us. You can also, again, email cball@howardcountymd.gov. Thank you so much and have a good evening.